Good morning. We're just opening up the webinar and we will be starting momentarily. We have a very nice, robust registration this morning or this afternoon, and we're so pleased to have so many people with us today. Hope you have plans for a nice weekend, and hopefully the weather will cooperate as well. So let's see, we're still filtering in. We're over 50. So this is obviously a topic of interest to folks. So we're so pleased to be able to offer it. And I think we're ready. So welcome everyone to our Focus Forum. I'm Rita Riker, President of the Board of Focus Greater Syracuse. Our topic today is childcare, and we have some great childcare experts who will be speaking on the topic. They will be formally introduced in just a minute. We're excited to have a robust registration, as I mentioned, over 100 registrants for this session, and we're scheduled for 1 hour as usual, and we are recording this session. Our format includes 5 to 10-minute presentations from 4 guests, followed by Q&A. We received a number of questions for today's forum, and we will ask as many as time permits. Board member Brian Hochul will be facilitating the Q&A period. Now, I'm very pleased to introduce a surprise guest, Lieutenant Governor Kathy Hochul, who has made time in her busy day to spend a few minutes with us. The Lieutenant Governor began her career as an elected official at the local level, serving on her town board, then as Erie County Clerk, and later as a member of Congress. Since 2015, she has served as the highest ranking female elected official in New York State government. Go women. She has championed a number of causes particularly pertinent to our topic today, including paid family leave, elimination of the gender wage gap, and expanded access to affordable childcare. She chairs the state's Women's Suffrage Commission and co-chairs the Child Care Availability Task Force. Lieutenant Governor Hochul, we're delighted to have you join us today.
Thank you. And I don't know if Laurie's coming on as well, but I'm delighted to be here. Rita, thank you for the invitation to participate in this focus forum for Greater Syracuse. What an ingenious idea to bring people together virtually on very important topics. And thank Laurie Black, the director of the Early Childhood Alliance, for her great work, and our commissioner, Sarah Merrick, who's been deeply involved in helping solve this crisis. We've worked together at a virtual child care availability task force event this time last year. And Laurie Schakow, who's been so involved. I saw her last year when Senator Gillibrand and I traveled the state, putting the spotlight on the challenges faced by so many parents. And when we did it last year, we were in the throes of the pandemic. And I think a lot of us thought it'd be winding down sooner than last July. And then we actually went all the way till, we're still dealing with it now. So I'm really pleased to join you to talk about what has been known by many of us to be a critically important issue and a really crisis situation, a crisis in the affordability and availability of childcare. But realizing now that people other than us are finally getting it. And I find that to be a tremendous bit of progress, one of the pandemic takeaways, that people are realizing that childcare isn't just a family's problem or a woman's problem. It's a problem for our entire economy. And there will not be a full comeback of our economy until we resolve this situation, which is keeping a lot of women who want to be at work, they're having to stay home to take care of their children. And as co-chair of the Child Care Availability Task Force, I work closely with agencies and communities and providers to figure out solutions. We just released our report a short time ago. I think that's going to be discussed today, but just top line of child care availability, we need to have a statewide standard for affordability, prioritize racial equity, and maximize funding programs for everyone, more access to childcare, help with the providers who really struggled through this pandemic, but also how we increase their numbers and their training, and also make sure it's high quality childcare. And we launched a $35 million program just last week as part of our Quality Stars program, which is going to have a very stringent rating system to make sure that we're giving children not just a babysitting experience, but a high caliber educational experience. So it's about the quality of the programs as well. Also, we need to pay our childhood workers, early childhood, and our child care providers. We have to pay them more fairly, and and help them advance their careers, because what parents are realizing, what society is not, is that these are really the first educators beyond the family that a child has. And they could have a very positive experience in a loving environment with an educational component, an important educational component, something I witnessed when I was all over the state in the last week visiting child care centers, a gingerbread house, most recently in Syracuse just a couple of days ago. But also, these are not babysitters. These are people who deserve to be paid for the caliber of skill they have, and also help us attract more people to this. We also need to have more coordination among having a data system so we can find out where there are slots available for families instead of leaving it up to them to try and navigate this complicated area. But I'll tell you what I'm proud to see, in addition to our continued focus on this, is Washington is paying attention. President Biden has been speaking for weeks, focusing on childcare and supporting working families. Just this week, families all across America, 85% of families are starting to see more money for child care and for their childhood expenses. Up to $300 a month per child are starting to show up in people's bank accounts. So this shows the priority of government at the federal level, the state level, as well as also giving us the resources that we have been needing for a long time. So we have now received $2.3 billion in federal child care resources to help boost access to quality care. As we mentioned, we have $25 million in child care scholarships for essential workers. And when you think about what people went through during this pandemic, especially in the early months when there was so much stress, people did not know whether you could contract the virus by touching a bag from the grocery store when you got your groceries. So a lot of anxiety. Well, people had to leave their homes and go to those grocery stores to work behind the counters and to stock the shelves and to work in pharmacies and fill our prescriptions, and all the food workers who had to be making all the takeout that we picked up curbside, as well as the obviously highly recognized, deservedly so, our medical personnel, our doctors, our nurses, our support staff there. And you think about how they all were able to show up at work. They showed up because the child care workers showed up. And if they had stayed home trying to address their own challenges, fear of bringing the virus back home, or maybe exposing an elderly parent who lived with them, everything would have just shut down. So we need to continue giving them recognition. And part of that is scholarships for them to be able to go to work by helping them with their child care costs. We also received $80 million of CARES Act funding that's been dispersed to the providers. We're excited about accepting applications for nearly $3 billion in funding. And we're going to be supporting, again, more expanded childcare in these deserts. So we know we've got a challenge in front of us. It's something that I thought would be in a better place by the time my children are in their 30s, when I had to leave a job I loved on Capitol Hill, working for Senator Moynihan when my son was first born 33 years ago. And now that he and his sister are of the age to be able to have kids, there's still a challenge out there. It's still a problem of affordability. The cost of childcare being equivalent to a education at a public college, which is crazy when you think about it, what families have to save for college, but they actually have to be saving right now for any children they hope to have in the future. And so it's been a real struggle for a long time. And I really appreciate the fact that as a result of the pandemic, one of the takeaways is that people beyond the family are recognizing it. And when I speak to employers, large and small, from Manhattan to Syracuse to Buffalo, and they're finally telling me that their biggest challenge is getting the parents back to work and helping them find childcare. I know we've made progress, and we need to capitalize on this moment to say, yes, thank you for recognizing something we've struggled with a long time, but all of you have a responsibility as employers to work with us in government and the families to provide more services. Maybe it's setting up a site in your workplace. If you're going to be expanding, you put on additional square footage to have an on-site childcare center. I think that's going to help companies increase their competitiveness, and people are going to want to work there, as well as consortiums, work with local businesses in a downtown area, take an empty storefront, pool together your resources, and start focusing on getting childcare there as well. So there's so many ways to deal with this, but I'm excited that this conversation is taking place. You're listening to people who really lived and breathed this issue for a long time, and they're the true experts. And I want to thank them for the role that they play. And again, thanks to Focus for putting the focus on this critically important issue for not just families, but for our entire economy and our comeback. Thank you.
Thank you, Lieutenant Governor. I'm sorry. We know you need to move on to the rest of your daily schedule, but this has been, we've really been delighted to have you with us. And thank you again for joining us today.
Thank you, everyone. Bye-bye.
Take care. Bye-bye. Okay. Next up, Laurie Black is going to set the stage regarding childcare in Onondaga County. Laurie is the director of the Early Childhood Alliance, ECA, a cross-sector collaborative working to improve school readiness throughout our county. Laurie was involved in creating the Early Childhood Alliance in 2015 and became the organization's first director in 2016. Prior to that, Laurie worked for 14 years for Syracuse 2020. She has worked for the New York State Assembly and the Maryland General Assembly. Laurie has a master's in public administration from the Maxwell School at Syracuse University. Laurie.
Thanks, Rita, and thank you, Lieutenant Governor. It was so great to have her here and just weigh in. She has been such a great leader on childcare issues for so long. And so she's a hard act to follow, but I'll try. And today's job for me is just to set the stage as I pass it over to what are really two phenomenal experts on childcare in our community, Laurie Schakow and Sarah Merrick. So we'll get to that in a second. But just first, I thought I would kind of share a little bit about the Early Childhood Alliance. Rita said I've been with it since the beginning, and we did start it in 2015 in response to an Onondaga Citizens League study that looked around the country and saw that maybe we weren't organized and strategic enough in building out our early childhood system. And so when I talk about early childhood, I'm talking about, let me advance the slide. I'm talking about birth to 5. So when we look at our early childhood system, we're thinking about children from birth to 5 and their families. And so in Onondaga County, we have 31,000 children birth to 5 and about 5,000 children born a year, which is a very manageable size to build an early childhood system around. So we're fortunate in that our size, we can do good things with the number of children that we have to support. One of the challenges that we do face, though, and this will not be a surprise to anyone at Focus, is that we have a high child poverty rate in Onondaga County. 1 in 5 children are living in poverty. In our city, it's disturbingly 1 in 2 children are living in poverty. The Lieutenant Governor mentioned, and there's been a lot of conversation recently about the child tax credit. We are very hopeful that that child tax credit will get in the hands of our families that need it, and that can help stabilize the conditions for many families. That poverty, we know, is a barrier for children entering school ready to learn. And that really is the overarching goal and focus of the Early Childhood Alliance, that we provide the services and supports to children birth to 5 so that all kids come ready for kindergarten. Now, unfortunately, in New York, we don't have a kindergarten entry assessment as kids come into school. So the first snapshot we see of how children are doing, which is really the North Star for the Early Childhood Alliance, is our 3rd grade reading rates. And you can see here that we've fallen pretty far below the statewide average. The last time we had a data point on these ELA tests, because they weren't given in 2020, is 2019. And we had 40% of our children across Onondaga County reading on grade level. So it just shows you the kind of work that we have to do, because we know they didn't fall off in 3rd grade. We know from national data that a child that doesn't come ready to kindergarten is less likely to be ready by 3rd grade. We also see the academic gap, again, with national studies, beginning as early as 18 months when children start developing language and vocabulary. So we have our work set out for us right here in front of us, in that we know we got to do a better job in building a stronger, more effective early childhood system. When we think about early childhood systems, we think about core programs that most communities have. They have Head Start programs, they have early intervention and preschool special education, they have home visiting programs. Most children make it to their pediatric well child visits. So these are what we call anchor programs in the early childhood system. Childcare, which we're going to talk about today, is a core component and a really important piece of the childcare of the early childhood system puzzle. But the work of the Early Childhood Alliance is about system building. And creating the Early Childhood Alliance, we had those core programs. But now what we do is we bring attention and resources, and we're so grateful to County Executive Ryan McMahon for the resource allocation that he is making into early childhood system building. So we have, over the last few years, been able to secure local and additional state funding, and now we're seeing a lot of influx of federal dollars potentially to strengthen this system. It's been an underfunded system, so we've had to bring the stakeholders together, to bring our business community and our cross-sector leadership, which has been extraordinary with the leadership of Meg O'Connell from the Allen Foundation, the United Way, and Nan Eaton and Peter Dunn from the Central New York Community Foundation, and so many partners and stakeholders. But again, the county leadership, we're going to talk to Sarah today, but also Ann Rooney, the Deputy County Executive, all of those folks coming together to have the conversation about what are we doing in this early childhood space? How do we strengthen it? How do we bring family voice to the table? How do we deepen our collective knowledge about child development and developmental screening and promote equity in the system? So all of that stuff that is in that green or that blue ecosystem is the work of the Early Childhood Alliance and what we've been working hard at over the last 6 years. But within the early childhood system, there are different systems, and childcare is one of those systems. And you can see here on this screen that we think of childcare with 3 different core components. And in a second, I'm going to introduce Laurie, and she's going to talk a lot more about these core components and what it's looking like in Onondaga County. But when we look at the childcare system, we talk about accessibility, affordability, and quality. Those are the 3 legs of the stool that hold up a quality childcare system. So enough from me. Today's focus is on childcare, and we really do have 2 of our community's experts on childcare. We're so fortunate they were in place when we hit the pandemic, because they, they don't get enough credit for this, but they truly helped to stabilize in partnership with the county executive, the childcare infrastructure in Onondaga County during the pandemic. Childcare, as we know from across the country, the conversations was hit hard as part of the pandemic, and lots of childcare centers did not survive, but yet Laurie and Sarah worked tirelessly to focus our community's attention on making sure that that childcare infrastructure was preserved as best we could during this time period. So Laurie Schakow, I'm going to introduce her. She is the Executive Director of Childcare Solutions, and she's been in that role since 2013. Childcare Solutions is what we call a childcare resource and referral agency, and they help families navigate to childcare and help support the childcare infrastructure in our community. Incredibly important asset to the work that we do at the Early Childhood Alliance. Laurie's a key partner. She's worked over 42 years in various agencies and not-for-profits supporting children and families. Her most proud accomplishment, of course, are her 2 daughters, and she has 2 grandsons as well. And so I'm going to introduce you to Laurie. And again, I think of her as a colleague, a partner, and a friend, and just an incredible childcare resource for our community. So Laurie.
Thank you, Laurie, and good afternoon, everyone. I so appreciate this opportunity to talk about childcare. It is definitely a passion of mine, and I am delighted that so many people were willing to join us this afternoon to have this conversation. As Laurie mentioned, we're going to talk about the 3 legs of the stool around childcare. So I want to start with childcare accessibility. And even prior to the pandemic, we were not meeting the needs of our community. And that was true across not only Onondaga County, but also New York State and, quite frankly, the country. We currently are only meeting about 28% of the need for childcare in Onondaga County through registered and licensed programs. That's down a little bit from prior to the pandemic, but pretty consistent from what we've seen, both nationally and across the state. Basically, what that translates to is that more than 3 children need childcare for every available regulated slot in the county. And when you look at the infant slots, which is the most challenging childcare to find for parents, there are only 769 seats for the approximately 5,263 babies that are born on average in Onondaga County every year. The way we come up with the need is based on census data. So we look at the American Community data most recently available, and then also we're really excited to get the data from the 2020 census to help us update some of these numbers. But basically we look at the numbers of children under the age of 12, which is the maximum limit for childcare, who have both or have all parents in the household currently in the workforce. And we use that formula to determine need, and then the available childcare seats are exact numbers that we can determine through the Office of Children and Family Services, numbers of slots that are available. So next slide, please. When you look at accessibility, we've had a significant change in the numbers of childcare programs since prior to the pandemic. So we lost about 40 slots between 2019 and 2020, or I'm sorry, not slots, 40 programs between 2019 and 2020. We did have an increase of 6 new programs so far in the first 6 months of 2021. But as you'll see in the next slide, please, that does not translate into a lot of additional slots. We're still, even though we added 6 programs, we're still 845 fewer seats available than what we had in 2019. So 845 more children that don't have access to a registered or licensed childcare program at this point. So next slide, please. The other piece that we really want to talk about is affordability. It's great that, you know, even if we were fully had enough slots for every child, if parents can't afford it, it is still not accessible to them. The United States Department of Health and Human Services recommends that childcare not exceed 7% of family income. And when you look at the average cost of care for an infant and a toddler in Onondaga County, it's in excess of $24,000. When you look at the median family income for a married couple, a little over $61,000, the child care results for an infant and toddler in 40% of that married couple's income. And when you think about single parents, the struggle is even worse. Next slide, please. Again, when we talk about affordability, I want to mention some of the things that happened over the past, or during the pandemic to help support. So between October and June, October of last year and June of this year, Child Care Solutions administered funds from the Office of Children and Family Services for scholarships for essential workers that were earning up to 300% of poverty. That really enabled a lot of families to and their children to get back to work. So 106 families, 155 children that were supported through those scholarships. And those were not just medical staff or fire or police, but also those grocery store workers and other essential workers that Lieutenant Governor talked about earlier. The beauty of the scholarships also were that 69 child care programs were caring for these 155 children, and the scholarships helped to stabilize those programs by providing really stable income throughout the pandemic for those children. And recently, oops, sorry, could you go back for 1 second? Other way. So New York State released a new essential worker scholarship program on June 28th. And for any parents or providers that are on the phone, you do have to reapply, even if you were one of those 69 that were receiving, or the 106 families receiving prior, you do have to reapply online at the OCFS website at ocfs.ny.gov. Thank you. Next slide. The last leg of the stool, we really want to talk about quality, because even if it's accessible and affordable, if it's not high quality, parents are not going to leave their children in care. And we want to make sure that all children have access to both safe, but also environments that are nurturing and promote their physical and intellectual development. So beginning in 2020, right at the start of the pandemic, really want to thank Sarah Merrick and our county executive and our county administrators, provided funds to pilot a 3-year quality improvement project that we are implementing with 3 child care centers and 10 family child care homes. And so through the project, the participants receive ongoing training and coaching to support implementation of a creative curriculum. It's a standardized curriculum, and to make sure that they're implementing it to fidelity. And then they're also given stipends to increase their pay, because when we talk about affordability, and we saw how expensive it is for families to afford care, but the reality is those funds, because of the restrictions on child and adult ratios and other expenses, the pay for child care workers, as the Lieutenant Governor mentioned, is really not sufficient to supporting high quality workforce. So we wanted to, as part of the pilot, show that if we increase pay for the providers, that we can reduce staff turnover, and also which is one indicator of improved quality, but also improve their quality by maintaining or allowing them to be focused on the children and not whether they are able to put food on their family's table in the evening. Next slide, please. So as part of this pilot program, we're about a year and a half into it now. Again, 3 directors, 4 assistant directors, 10 teachers, or 12 teachers and 10 assistant teachers, and 10 family child care providers have all improved the quality of their care through the implementation of the curriculum. An exact number, 150 infants and toddlers, and it's mostly toddlers, fewer infants are receiving that high quality care. And one of the things that we've already noticed is that prior to implementation of the pilot, staff turnover was around 24% in childcare programs, and it was reduced to only 6% for these program participants, even despite the pandemic. So we feel like that's really good turnover. We're also doing working with an independent evaluator to assess the specific quality markers within the program in terms of using a class assessment tool to determine the quality of these programs. So more to come on that. And next slide, please. In addition, for quality in 2020, during the pandemic, child care grants were distributed through Office of Children and Family Services. Child Care Solutions implemented them, and 68 programs were able to receive in excess of $83,000 to reopen their programs, those that had temporarily closed during the pandemic. Which is wonderful news and great for those 68 programs. But the sad part of it is over $50,000 went unspent in those reopening grants. For the 68 programs, there were a lot of hurdles to accessing the funds, and they had to spend the money in advance and then get reimbursed for it. So they left a lot of money on the table. And then there were 10 programs that were eligible and had been awarded a grant that never accessed any of the funds because they couldn't afford to front the money in advance. Likewise, there were 36 childcare programs that received over $500,000 in restructuring grants. So these were grants that enabled providers to, purchase things like dividers for rooms, or, kind of like in the school district where they put those petitions on student desks, to purchase PPE and disinfecting supplies, to, maybe expand their childcare area, the facility, so that children had more space, so they could keep the 6-foot social distance, things like that. So again, that was a lot of wonderful money that came into the community. But again, it was money that providers had to spend in advance and get reimbursed for. So there was almost $300,000 that was left unspent, and another 10 programs that did not access any of the funds that were awarded to them. And next slide, please. And now we're to Sarah. Thank you.
Thank you, Laurie. And as I said, Laurie has more knowledge about childcare than anyone I've ever met. And so we are so fortunate to have her as a resource. If you haven't been to the Child Care Solutions website, there's tons of resources there. If you know of people who are struggling to find childcare, Laurie has a whole team of staff that are able to help families navigate to resources. And so definitely connect with Laurie and her team at Child Care Solutions if you want to learn more about our childcare infrastructure in Onondaga County. Next up, I have the pleasure of being able to introduce Commissioner Sarah Merrick. She's the Commissioner of the Department of Social Services and Economic Security. And she has been in that role for about 7.5 years. And she is another extraordinary resource. I always say with Sarah that if you were opening up the dictionary and looking up public administrator, her picture would be right there, because she is the epitome of what Maxwell School trains for public administrators. She's curious. She's always looking to do quality improvement. She's a systems thinker, and we are so fortunate that she was at the helm of the Department of Social Services and continues to be there as we continue to work our way out of this pandemic. She's worked for the county for over 18 years. Prior to working for the county, she was working for the United Way. We kind of joke with each other because she was the first director of Success by Six, which was the precursor to the Early Childhood Alliance. So some of you around the call may remember Success by Six. Sarah was the first director. And so her heart and passion really is about early childhood. And we are fortunate that she is engaged with us in the early childhood system building and planning here. She also, as Lieutenant Governor mentioned, served on the governor's childcare availability task force. And so there's a lot of great lessons that she and insights that she has about the direction that the state is headed with childcare, as well as the federal changes that are happening. And so that's what she's going to talk to us today about, is the bright lights on the horizon. I think when we went into the pandemic, we thought all was lost for childcare, and we're actually coming out with a lot of attention, focus, potential. As Lieutenant Governor said, the president is also talking about childcare and making significant investments in childcare. So there is a lot of great opportunity. And what we want to do as Onondaga County is make sure that we're positioned to take advantage as a community of all these resources. And we have the right person in place in Sarah Merrick in helping us to do that. So I'll toss it to you, Sarah.
Thank you very much, Laurie. Yeah, this is an exciting time. I feel like, as both Lauries have said, prior to the pandemic, there really was not a lot of attention on childcare, and we were trying to figure out how to get people to really focus on this. And one of, believe it or not, a positive result of a pandemic is that I think parents, employers, government, policymakers are finally going, oh, this is a system issue that really has to be addressed. So it happens to be great timing because the governor launched a statewide task force on childcare availability back in 2018. For the first year, we were actually meeting monthly in Albany in person, and then the pandemic struck. And so we learned how to meet remotely through Zoom monthly. But it really was a task force of providers, government officials, employers, foundations, you name it. Any entity in New York State that was interested in really finally addressing our needs around childcare was around that table. Ultimately, finally, the report was released in December. And I really believe that aspects of the recommendations, some of the aspects were incorporated in this year's state budget, which is pretty, those task force members, and again, I'm one of them, we're very, very pleased that we actually saw that the report get some legs and traction and get some financial support. So I am not going to read the bullets. Lieutenant Governor Hochul really covered the task force recommendations. I do want to keep emphasizing the same themes that both Lauries have said. It is a three-legged stool. It's about affordability for parents. And later slides, I'll get into how the state is beginning to address that, at least for some segment of our population. It is accessibility. And we know that there are deserts where there isn't childcare in our community. And through ECA, we're commissioning a study, a needs assessment, so we can identify where the needs are so that we're prepared when some of this federal and state money is available. We can address some of our access issues. And three, the high quality childcare. You cannot pay childcare employees minimum wage and expect that we are going to have high quality educational developmental outcomes for our youngest children. So finally, we are getting a spotlight on this and moving the attention to that childcare workers are educators, and we must move them up to parallel wages to our educational system. And until we do that, we are not going to get the necessary outcomes we need to make sure that our little ones are ready when they enter school. So, and we all know, I've been in this business a long time. Laurie said, success by 6. We knew back 30 years ago, the brain research was saying invest in infancy to 3 and huge dividends. We're finally, I think, going to have that kind of investment we need. And then a coordinated system. Yeah, it is a fragmented system. The state really needs to invest in a way in which we can assess need better and connect parents with the resources that are available. So moving on, next slide. So very quickly, the pandemic resulted in a major infusion of federal dollars in the area of childcare and to New York State. $1.8 billion of additional resources for childcare is pretty incredible. Most of that 1.1 billion is going to be given to as direct grants to providers. This has never been done. It's pretty unheard of. But I think there's a realization nationally and statewide that the pandemic resulted in closures, and those providers that remained open were kind of limping along because they were not at full capacity. And an infusion of direct grants must happen for us to stabilize the existing childcare system we have and then regrow it to the capacity that we need in the community. So there's a lot of words on this slide, but I just wanted to emphasize 1.8 million and the fact that 1.1 billion of it is going to go to direct grants and an infusion of cash to the provider community. Next slide. These are some of the things that they can request these grants for. These are grants, these are not loans. That's great because childcare providers are not in a position to pay back a loan. They're just not that financially rich, let's put it that way. Next slide. So that is major what's happening with the federal dollars. But what is also happening in conjunction with the federal dollars that are coming and some aspects of the task force recommendations, the New York State Legislature and the governor signed significant changes in this year's budget. So we have many more resources for childcare subsidies, which I'll get into a little bit more. Again, this infusion of grants, a continuation of the scholarship programs for essential workers for a little bit, money finally to back up Quality Stars so that we can really address the quality issues. And again, as I said, we want to position ourselves to be ready to identify where our childcare deserts are so we can use those capital funds to create more capacity in the community. Next slide. So this is really my world. This is the world of county government, Department of Social Services that administer childcare subsidies for families whose incomes are normally 200% over the federal poverty limit. But in our county, we are one of 9 counties across the state that have additional funding called facilitated enrollment. Some of you might have heard it, it's WDI money. So we are lucky. We can serve families at 275% of the poverty level. So remember that slide way back when we were talking about a married couple with 2 children and their median income was a little over $61,000. So they, in our community, are eligible for subsidies. And because of the other significant change in this budget is that the family copay in Onondaga County used to be 35%. That's a lot of money. all right, even if a family is eligible for subsidies, it became that the subsidy just didn't cover enough of the expense with the parent obligation. So I just wanted to give you an example that now we're looking at that family now eligible, and we're looking at, just looking at my notes, I want to be right. So before the state passed this 10% maximum cap, that same family would have been paying over $16,000 a year for their parent share for one child. Now that same family is going to be paying $4,600 a year for that same child. Now it's still a lot of money, but it is a significant decrease, and we're finally starting to address affordability in this state and this county. So I covered the eligibility criteria, I covered the copay, and then there's two other things that are good. One for the family. The family now is basically guaranteed childcare subsidies for 6 months versus for 12 months versus a 6-month recertification process, where 38% of our cases would close in the past. So this is going to extend childcare services to those families. And then finally, to really help infuse more funds into the provider community, we're going to be required to pay for absences. We in the past did not have the financial means to pay for absences. So long story short, pre-COVID, we were spending about $19 million on subsidies in this community. We are looking like we're probably going to be at $36 million on subsidies on an annual basis. Again, the federal and state are offsetting all of these increased costs, so that is very good for our community and for our local taxpayer. I think that was the last slide. Is that the last slide, Laurie? Yep. I think I covered everything except for, I think I covered it all. I do.
I think you did a great job. I think we're on time. I am going to turn it over to, I think, Brian to facilitate a Q&A period. But thank you both, Laurie and Sarah, for sharing as much as you could in such a short amount of time, but really a robust discussion about where we are with childcare.
Great. Well, thanks, Laurie. I'm Brian Hochul, a volunteer with Focus. Thanks to everybody who's joining us, in particular to our panelists. And we have some questions that folks have sent in advance. You're welcome to put some in the Q&A. Chances are we won't get to them, but appreciate all the questions folks sent in before. So first up, I'll address these to either of you, but please feel free to chime in as you wish. We had a question regarding the availability of trained workers in childcare in our community. Laurie, do you want to talk about that? I would imagine there are some challenges in finding people. What might you say about that, please?
Absolutely. Before I respond to that question, though, I do want to just mention one other thing that I would really remiss if I did not mention. I want to really thank Sarah Merrick and Onondaga County for throughout the pandemic and right from the very beginning of the pandemic, before the New York State OCFS made any additional investments in childcare subsidies, Onondaga County made the decision to provide scholarships for childcare for any and all essential workers, regardless of income, and also waived the parent fee for all families that were participating in the subsidy system. And their reason for doing that was when the schools closed down, a lot of families that did not have prior childcare expenses suddenly found themselves with all of these childcare costs. And we did not want to be in a community where our essential workers couldn't go to work because they didn't have childcare available to them. That not only helped those families and children of essential workers, but it really helped the childcare system in our community as well, because as we talked about the numbers of programs that closed down in Onondaga County, that was far fewer percentage than what we saw across the rest of the entire state and country. So kudos to Onondaga County for stepping up and doing that. Really great work. In regard to the availability of trained workers in the childcare profession, like most industries across the state and country right now, childcare is really scrambling to fill their workforce. And as a result, many of those registered and licensed childcare slots that I talked about earlier are available technically, but not really, because there are a number of childcare centers where they have classrooms that are closed because they cannot find qualified teachers to man the classrooms. And it's not like other industries where you can just run short-staffed. There are very strict child to adult ratios that childcare programs have to follow to remain in compliance with the licensing. And if they don't have the workers, they cannot accept the children. So there are a lot of slots that are going empty right now, simply because they can't fill the workforce. That being said, just yesterday, I completed the first round of interviews for a new Career Development Leadership Institute regional coordinator. That's in partnership with the New York Early Childhood Professional Development Institute. And the role of that person will be to work with existing child caregivers to help them increase their professional development. Somebody that has a child development associate's degree, as an example, that is now interested in maybe getting an associate's or a bachelor's degree. So they'll really work very closely with that person to help them fill out scholarship applications and connect them with the right schools and colleges for them to be able to increase their education. And there is also new money coming through New York State Office of Children and Family Services. Just signed the contract last week for some of the stabilization grant money, where we will be hiring probably sometime this fall an individual to address childcare deserts in our region, not just Onondaga County. This career regional coordinator will also not just serve Onondaga County, but will work with providers all over. So that the career desert or childcare deserts position will be really going out into those communities where there is little or no childcare available, to recruit individuals that may be interested in opening a family childcare business in their home, or as the Lieutenant Governor talked about, some of those industries that might be interested in opening a daycare center within their workplace.
Gotcha. Thank you. Sarah, do you want to come in on that?
It's all about money in childcare. So, and to be honest, it will require billions of annual dollars invested in childcare in this state, and that is what is needed. And until we can get enough money going into the provider community so that we are adequately compensating childcare workers for their skill set, it is going to be a struggle. And it's almost like we need to say from now on, a childcare worker is going to make $50,000 a year. And then we're going to have people actually wanting to go into this field. We really have to get the salaries comparable with public education. And right now, unfortunately, subsidies, which is there's the subsidy world, which again I was talking about, that is all the federal and state and local money, and then there's the private payer. All right. But it's all the subsidies are based on a market rate system, and the state every 2 years does a market rate. And unfortunately, they don't pay 100% of market rate. They pay 69% or 68% of the market rate. So they're not even paying the true cost. And so our subsidy system is deflated and is not paying the true cost of running a child care center, for instance. So the task force raised this issue, and that's the fundamental issue that has to be reworked in New York State. We've got to figure out how to compensate providers for the true cost of care, which relates to paying employees appropriate wages, which drives being able to attract the workforce we need.
And inextricably linked, right? I mean, I'm just, and thank you for segueing on to questions that we saw, but how do you attract and retain qualified people? And obviously pay is a huge part of that, but then yet not drive up the cost to the people who are consuming those services, right? You mentioned the one piece of that you mentioned in your slide was the paid absence, right?
Yes.
As part of that. Are you worried that, well, I'll softball this one, a big influx of money now, but in terms of sustainability going forward, I mean, some money now is great, better than nothing, but in terms of going forward and sort of leveling those things out, do you feel, I mean, everybody on this panel, I've been heartened to hear the hopefulness of what I thought would have been a much more negative, but does it seem like, oh, things are getting better and we're moving in the right direction? Or I'm sure there's much work to be done, but how do you see it going long term?
You know, I will just say that, you know, we've analyzed these changes a few years ago just to be prepared for potential implementation. But just to give you an idea, based on data we did about 4 years ago, paying for 24 absences per child a year for who we were serving 4 years ago, that is a $7 million ticket just alone. So everything in childcare is a lot of money. So one change is millions and millions and millions of dollars. So Brian, I would say I'm hopeful, but the federal infusion of dollars and the state infusion of dollars, there's going to have to be soon a commitment to continuation of this, because right now there's no certainty these dollars are going to continue to be allocated, and there is no way that parents can pick up this tab. It has to be a public infusion of resources, just like there's a public infusion in the public school system. There's just no way that parents can pay for the true costs of quality care.
Gotcha. Laurie, do you want to say anything on that? I know we just have a few minutes left, but on the supply side, if you will, in terms of, obviously your organization does lots and lots to help direct providers in this area of retaining people, paying people. But any last thoughts from you on that topic?
Yeah, I mean, I totally agree with Sarah, and that's a lot of the work that we have been doing throughout, you know, for many, many years now around advocating for childcare providers for pay equity, quite frankly. And, you know, when we talk about that three-legged stool, and you mentioned the absences, so the 24 paid absences is a great bonus to childcare providers because it helps them stabilize and they know that they have steady income coming in. But it impacts quality because it's 24 days that those children are not in care getting that early care and education. So it's a kind of a mixed bag, and that's what the whole entire childcare system, we could go round and round. Yeah.
Gotcha. Well, I'm sorry, I'm sure I am not alone in that I would much enjoy doing this for another hour. I appreciate hearing everybody, but I'll turn it back to Rita. Thank you, everybody.
And thank you to our panelists, Laurie, and Sarah. What an interesting session. So much appreciate all the information that you have provided us. I did see in the chat that there was a question of whether the PowerPoint could be available. And if so, we could put it on our site, or we could find a different way. But since when we put the video on, so think about that, and if it is possible,
Of course.
then we'll add it to our site along with the video. So I hope everyone else has enjoyed this session as much as I have. We will, as I mentioned, we'll put the video out on our website, focussyracuse.org, in the next couple of days. And there's also an opportunity to donate to Focus on our website. And we are we've been talking financial issues, and we are a very tight, frugal organization, and we could use any support that's available. So other than that, I want to thank you again, and have a great weekend, everyone. Take care.
Thank you, Rita, and everyone.
Bye-bye.